So I am in the medroom. I have familiarized myself with my patient. Her name is Irina Tract. She's here for a bladder infection. I am ready to go and pull her meds from the order. So I have her MARP pulled up here, and it looks like I will be pulling some sodium chloride 0.9, so normal saline at 125 milliliters an hour, continuous IV is the order, and then ondansetron, which is an antiemetic, 4 milligrams every 8 hours PRN as needed for nausea and vomiting, and then intravenously by push. And then also sevazolin, her antibiotic for that bladder infection, 500 milligrams every 8 hours, IVP. All of that sounds right. I agree with that. I verify, okay? And so I'm pulling the medication. So again, doing my second check, you know, ondansetron, 4 milligrams is 2 milliliters, so I will be pulling 2 milliliters. I have my syringe and my little tube or needle to draw it up. Okay, we got that. Right patient, drug, dose, route, time, good. And then pulling the sevazolin, which I'll be pushing, it's in dextrose 5%, that matches. Okay, my 5 rights, they match, okay. And then I have my normal saline, it's a liter bag. Yep, that's right, this is right. Nothing is expired. The condition looks good, it's intact. Okay. And then I'm gonna need primary tubing, secondary tubing. While I'm in the medroom, I'm going to start off by priming my normal saline. So here I have my tubing. I'm gonna take it out. And I do that by grabbing the spike in the end, because I want to keep those things sterile, or those parts sterile. So here I have my bag, and I'm gonna take off this plug. Maintaining sterility, gonna take the cap off the spike, and I'm gonna spike my bag. Perfect. And in the medroom, I'm gonna hang it, if possible. Okay, still holding on to this. Now I'm making sure that my sliding clamp is up, making sure that my roller clamp is also up and locked. Okay, it's locked. So I am going to prime my tubing. I fill up this chamber by squeezing it like twice. There we go. And then I have a trash can. I'm making sure that this is sterile. I unlock this slowly. There we go, it's dripping. Oh, okay. So perfect, that is nice and primed. Tubing is good. So, okay. The blue cap fell off, but I'm gonna pretend that didn't happen. I'm reusing this, okay. So I primed my tubing, everything is sterile. Hanging it right there, okay. Perfect, and then I'm going to label my tubing with a label. It's right here. According to the date, this is going to be continuous, so 96 hours after date, time, my initials. Okay, she's good. So my ondansetron, again, verifying it's right. I'm going to take off the lid. I'm going to grab an alcohol prep pad, and I'm going to scrub really well for 30 seconds. Okay, dry to die, so it's gonna dry. I'm gonna take my 3 milliliter syringe, since I will be drawing up 2 milliliters per order. Okay, that was put in the packaging correctly, that's fine. Okay, so keeping that sterile, opening up this, I connect it for the lure lock, uncap, draw up 2 milliliters of air. This is nice and clean. I'm gonna poke it in the vial, and then put the 2 milliliters of air and then invert it and draw up the medication. There we go. Okay. And I have definitely, like, my hands are clean. They've been washed, of course. So making sure that this is 2 milliliters, no air. Okay, that's good. Recap using the scoop method. Okay, so I have this prepped and ready. I'm gonna label my syringe. What it is, name, date, time, make sure it's labeled. Okay, this is labeled. I have that prepped. And then I have my secondary medication and the secondary tubing, but first I'm going to bring this with me actually. Bring everything with me and take it with me to the patient's room. I'm ready to go to the patient's room. Okay, so, and I'm bringing this too. Okay, knock knock. Hi, hello, give privacy, wash hands of course. Hi, my name is Marilyn. I'm going to be your student nurse today. I am here to start you on some fluids. I saw that you're here for your bladder infection. The provider has put in an antibiotic for you to treat that, as well as a medication which I'm going to give you called ondansetron, which will help with any nausea and vomiting side effect symptoms from the antibiotic to kind of prevent that. And then I'm also going to be giving you some normal saline for hydration. Is that okay? Is now a good time? Okay, perfect. Can you please verify your full name and date of birth for me? We're being tracked. Yep. Matching with the RN. Perfect. I'm RN. So I'm going to move my patient a little bit. Okay, but before anything, I need to assess your IV site. So I'm looking. Okay, I don't see any signs of infection, no phlebitis, no arrhythmia, no redness, looks good. I don't see any infiltration, extravasation, perfect. And then I just want to make sure that your IV line is working. It's patent. So I am going to I'm going to scrub this really well for 30 seconds. Let it dry fully. Okay. Keeping that sterile. I'm going to flush with about 3 milliliters of normal saline. Draw back, get rid of the air. Perfect. Okay, this is dry. Okay, so about a milliliter a minute is how fast I'm going to push this. Okay. Yep, it's been 3 minutes and it's working. Perfect. All right, and then I would cap it with chlorhexidine. Okay, so. All right, Erin, I'm going to start off by starting you on the normal saline. I have my MAR and stuff right here. So just verifying again at bedside with the MAR, the 5 patient rights, right patient, drug dose throughout time. I did the calculations to figure out the drop factor per minute. How I did that, I looked at the tubing. It was 10 drops per milliliter. So taking into account the 125 milliliter an hour, that came to roughly like 21 drops a minute. So that looks good. All right, Erin, I'm gonna hook you up to that normal saline. Okay. So I ensured patency. Oh. Okay. All right, can I your IV site again below. It's been 30 seconds. This is sterile. Making sure this is closed. Okay. I'm gonna take this blue cap off. Okay. All right. You are connected. Just put in my things. Okay. And then I'm going to set the drop rate, like I said, 21 drops a minute by slowly releasing the roller clamp. It's dropping. Looks good. Okay, it's 21 drops a minute. Cool. Okay, so that's going. Next, so like I said, I will be giving you cefazolin, which is your antibiotic to treat your bladder infection. But before that, I'll be giving you your ondansetron for that nausea, vomiting symptoms that might come with that medication. And so I prepped that in the med room. It's right here. And it's nice and labeled and it's ready. Again, doing my bedside check. Right patient drug dose route time. This has an onset of 10 minutes, and so I'm gonna give this to you and then set up your antibiotic. I'll be back in 10 minutes after I get this, but how I'm gonna do that is, oh boy. Okay, so alcohol prep pad, that's going. So there is a little port right here, which is what I'm gonna use to give that ondansetron. And I have to clean that really well. So cleaning, scrubbing for 30 seconds, letting that dry. Now before I push this medication, I have checked to see the rate that it's going to be pushed. And I'm gonna push it at about a milliliter a minute to be on the safer side. And so I keep the tubing for the normal saline, the primary tubing, right here. And so this is nice and sterile and clean, making sure not to contaminate. I'm gonna remove the needle or the tip. So nice and clean, nice and sterile, making sure to anchor because I have shaky hands. There we go. Luer lock. Okay, I'm still, I would flush before giving the medication, but I was told that because it's been running that normal saline at the rate that it has, that it would be fine to give the medication and then do the flush after. And so here I am, I'm pushing. Since it's 2 milliliters, this is taking me 2 minutes. 2 minutes later, okay. Wonderful, okay. And I wanna make sure not to contaminate, so I'm not taking this off right away. I have my normal saline. There we go. Pulling back on the syringe and then pushing to get rid of that air. Okay, so I am removing this. It is very sterile. It's sterile. Okay, we're connecting with the normal saline. It's still clamped here, and I'm gonna push this normal saline at the same rate that I pushed the ondansetron, because I don't want to let it go and it'll go the same rate as the normal saline, because that's bad. Okay, so we're pushing. And again, about like 3 milliliters of normal saline flush, about a milliliter a minute. Whoa, it's been 3 minutes. Okay, cool. Okay, so that's good. And then I would put like a chlorhexidine cap on it. Okay, perfect. So, fantastic. I grab all my supplies and then throw them in the trash. All right, Erin, so I've given you your normal saline and your ondansetron. I will be back in 10 minutes to give you that antibiotic. But before I do, are you feeling okay? Yeah, okay. Have your collet here. If you start feeling a little bit uncomfortable or nauseous, common side effect of ondansetron is also headache. Just, you can call me and I'll come check on you, okay? Perfect. Okay, so, I know I brought this with me, but, so I'm giving the patient like 10 minutes for that ondansetron to really like kick in. And so, I have my cefazolin and dextrose 5% here, just, and then I have the secondary tubing. And so it's been 10 minutes later. I'm going back into the patient room. Okay. Hi, Erin. How are you feeling? Feeling good? Awesome. Okay. I have your antibiotics for you. It's called cefazolin, and this is going to help for your bladder infection. Some common side effects are nausea, vomiting, genital itching. Those are all common side effects, but I gave you that medication earlier to help with that nausea, vomiting, so I'm not too concerned that you will be experiencing those, but of course let me know if you do. So here I have it. See, it's still flowing at the right rate. Okay. So I'm gonna set the medication down right here. I did my bedside check. Obviously clean hands every time I go into the patient's room. So in the package, since I will be hanging it piggyback, I'm gonna take this hook out. All right, and so I'm gonna move your normal saline down because your antibiotic needs to go above it. So here, kind of like before, I grabbed the spike, I grabbed the end with the blue tip. Okay, there we go. I have this, and I'm going to be priming this tubing, doing the backflow method. And so, keeping sterility, did my bedside check, right patient drug dose route time, perfect. Okay, and then I educated my client on what it is. Can you confirm your first name and last name and date of birth again for me? Awesome. Okay, just gotta do that to 5 rights, keep you safe. Okay, so I take the plug off the cefazolin, keeping sterility. I take off the cap of the spike. Okay, and then spike it. And before I invert it, I make sure that it's locked. And I would label my tubing, of course. Perfect. Okay. So it's locked, shouldn't spill. I'm gonna hang it above my primary tubing just for now. And I will be connecting it here on this port, which I'm going to clean. Clean the port, 30 seconds. It's nice and dry. This keeping it sterile. I am going to actually lock my primary roller clamp, and I'm gonna take this blue cap, making sure it's sterile, and connecting it right here. And that was scrubbed with alcohol. It's good. Okay, so it's connected. It is not primed yet. How I'm going to prime it is I am going to grab this and lower it from the normal saline bag, and I keep this, I'm going to keep this open. Primary is locked. Yes. And I'm going to hold it low. Yep. Oh, normal saline is going in the tubing, and then, okay, that is primed. And so I'm going to hang it above. And I did the calculations for the cefazolin, and the drop factor again was found in the tubing, and I calculated that to about 17 drops a minute. So, all right, Erin, so I have your antibiotic nice and set up. I'm going to put it at 17 drops a minute. I'm going to release the primary roller clamp. Oh. This is on the left. Okay. All right. Oh, there it goes, there it goes. Okay. It's nice. Okay, with the primary roller clamp, that's how I control the drop factor, or the drop rate of this. It is 17 drops a minute. Looks good. All right. Perfect. All right, Erin, so your antibiotic is going at the appropriate rate, and it will be done in about 30 minutes. So I will come back and I'll have to change the rate back, because then the normal saline will be going through, and that's a different rate. But I would hang out with you a little bit, assess you, make sure that you're not having any adverse reactions to the antibiotics. Okay, it's been a few minutes. All right, here is your call light. I will be back in about 30 minutes. Do you have any questions? Do you need anything? Okay, all right.